Okay, I'm going to assess the patient's individual needs and abilities. I'm going to verify the physician's order. I'm going to gather all of my equipment. And then I am going to review the appropriate reference material as needed. I'm going to enter the patient's room. I'm going to do my hand hygiene. Hi, my name is Frank. I'm going to be your nurse today. How are you doing?
Good, how are you?
Great. What's your name?
Chelsea.
Perfect. And your date of birth?
598.
Perfect. All right, I'm just going to raise your bed to a good working height, if that's all right. Do you know where you are today?
Yeah, the hospital.
Okay, great. And do you know why you're here?
I had a fall.
Perfect. Sorry to hear that. And can you tell me the date today?
March 6th, 2026.
Perfect. Okay, today I'm just here to do a head-to-toe assessment before we start working on your meds and everything. Is that all right? Should only take about 10 minutes, then I'll be out of your hair. Okay, perfect. I'm going to provide privacy and ensure proper body mechanics and ensure the patient is comfortable. So we're just going to start with your head. I'm just going to feel, are you having any pain or headache right now?
No.
Okay, great. And then I'm going to do the same with your neck. I'm going to look at your jugular vein. No swelling. Does any of this hurt? Okay, great. Now I just want to check some of your facial nerves. So I'm going to have you just pick a spot on the ceiling and look forward. I'm going to shine a light to the side of your eye. It shouldn't be too bright. Okay, great. And then other side. Perfect. And then I'm going to have you just focus on the tip of my pen light. Perfect. And then focus on the tip of my pen light again, and I'm going to have you follow it with your eyes, but keep your head still.
I'm gonna wash my hands.
Hi, my name's Maya. I'm gonna be your nurse today. Is right now a good time? Can I verify your name?
Perfect. And then I'm just going to take a quick peek in your ears, and then could you tilt your head towards me? Great. I'm going to look in your nose and your mouth. Can you say ah? Beautiful. Can you stick out your tongue and move it side to side? Great. Can you smile and puff out your cheeks? Raise your eyebrows. And then I'm just going to palpate your TMJ. Can you just open your mouth? All right. Perfect. Thank you.
Right.
Okay. So now I'm going to move on. I'm just going to check your arms. Can you let me know, do you feel this?
Yes.
Perfect. Feel this?
Yes.
Okay. Do any of those cause pain?
No.
Okay, great. Can you grab my 2 fingers with your hands? All right, squeeze as hard as you can. Pull me towards you. Push me away from you. Great, thank you. I'm just gonna feel your radial pulses. I'm gonna bring this hand over here as well.
Do you have any pain anywhere that I need to be aware of? Any past medical history that I need to be aware of?
Great. Then I'm just gonna check your capillary refill on both hands. Your hands are warm. We love that. Okay. Now I'm just going to take a listen to your chest. I'm going to start with your lungs. Every time I lay my stethoscope down, I'm just going to have you take a deep breath. I'm going to use the diaphragm of the stethoscope.
I was like, just cut here and then clip it. I was like, shit. I was like,
And then have you just lift your arms up a little bit. Okay, perfect. And now I'm going to do the same over your heart. Just breathe normally. I'm going to just feel for your sternum.
And then I'm just gonna take a look at well, I feel like you could probably start from there, and because you can have a cut in here. Yeah, you can cut it. You can have just like a little.
And then lastly, I'm just going to listen in the mitral area for 1 minute for your apical pulse. Okay. Now I'm just going to take a look at your abdomen. Have you been having any pain there recently? Great. And when was your bowel movement? Okay, perfect. And then have you ever had any trouble with urination recently? Okay, great. Just going to listen.
Well, you know me, I'm always all.
And then I'm just going to palpate as well. Can you let me know if you feel any pain?
Take some water.
Alright, I'm just gonna take that.
Any of that hurt?
No.
Okay, great. And then lastly, I'm just going to do around the belly button. Perfect. I'm going to have you sit up for just a minute. I am going to listen to your lungs as well in the posterior. So just take a deep breath every time I set my stethoscope down. I'm going to go above your scapula.
Washing my hands.
beside the scapula.
I'm Nurse Maya. I'm gonna be. Oh, I'm here.
And then below.
Before we get
Okay,
started.
perfect. And then I'm just gonna palpate the costovertebral angle. Does that hurt? Okay, great. You can lay back down.
I'm gonna provide you with privacy.
All right. So I'm gonna do the same thing I did for your arms, but with your legs. Do you feel that? Okay, great. Any pain?
I'm gonna ask you a bunch of silly
All
questions
right.
here.
I'm gonna take a quick look at your legs, take a look at the hair pattern, check for edema. Not seeing any. Hair pattern looks great. Right. Can you lift your legs
You know
off the
why you're
bed?
in the hospital.
Perfect. Can you press on my hands like gas? And then bring your toes towards you. Great. Just gonna feel your pedal pulses.
Do you have any major?
All right. Check your cap refill.
Aware of injuries?
Okay, great. Your feet are
Past
warm.
medical history that I need to be aware
Okay.
of?
So that is my head to toe assessment. I'm gonna return your bed to a safe area and make sure you have your call light. Is there anything else I can do for you right now? Okay, great. Once the bed is ready, I am going to remove privacy. I'm going to make sure I have all my equipment with me. I'm going to do some hand hygiene. I'm gonna head out of the room. I'm gonna document everything. And that is all.
And push towards me.